All right, so thank you everyone. So before we begin, for those of you that don't know what the HIE is, I thought I'd show a video that'll give you an idea. And this, even though it's a Healthy Nevada video, it'll kind of give you an idea of what all HIEs can offer. So let's do the video first, and we'll go ahead with our presentations. So that was our Healthy Nevada presentation, but as I mentioned before, all HIEs will be able to offer you this kind of information. So without further ado, we'll start with our first presenter, Brenda Hood. She's from the Healthy Nevada HIE. And Brenda Hood joined the Health Information Exchange of Nevada in 2017 as a project coordinator. Prior to holding this position, she has 8 years of experience working as a discharge planning coordinator with case management and social services for both Valley Health System and Hospital Corporation of America in Nevada. Her professional experience includes initiating, coordinating, and executing discharge planning within the standards of best practices, as well as state and federal regulations for short-term acute inpatient hospital settings for the assigned caseload from date of admission to the date of discharge. Ms. Hood has spent more than 20 years with the healthcare industry, implementing policies and procedures for discharge planning, National Bone Marrow Donor Program for Southwest Care Clinics, and was a member of the Contract Health Utilization Review at Cam Memorial Hospital and Indian Health Services. Brenda, I forward it to you.
Thank you. Hi, everybody. I just wanted to go over some general information on how the HIE can implement and improve quality of care across the board. What I wanted to focus on today was just a particular diagnosis of hypertension and how it has a big impact within our healthcare industry. Next slide, please. First off, I just want to share some basic information about hypertension and its effects on an individual if not managed correctly. Research states that 1 in 3 US adults, or approximately 75 million Americans, have hypertension. It's also referred to as the silent killer and is the most common condition which increases the risk of heart disease and strokes, which both of these are the leading cause of death within America. Next slide. If hypertension was not managed appropriately, it can cause kidney failure, blindness, strokes, and heart attacks. And to prevent these chronic conditions, a clinician needs to monitor an individual's blood pressure, lab work, patient's weight, and medication treatments on a routine basis. Next slide. So what is an HIE? HIE actually means Health Information Exchange, which is a one-stop database for clinicians to be able to view a patient's entire healthcare profile. And HIE provides a patient's history of medications, labs, imaging, and important clinical documents like history and physicals, operative reports, consults, discharge summaries, and routine progress notes. Next slide. So what are some values of an HIE? Well, here at Healthy Nevada, these are the three that we focus on the most, and the first one is quality. It improves quality of care by improving decision-making at point of care. It improves care coordination and improves better patient experiences. Secondly, it improves the safety of the patient by sharing continuity of care from all care settings, which allows clinicians to access allergies, medications, which in return decrease medical errors. And most importantly, it's cost savings. It provides the HIE from having duplicate testing and improves population health management outcomes and lowers costs. Next slide. So who can connect to an HIE? Here at Healthy Nevada, we focus on filling in the gaps within the healthcare industry. I think all of us have experienced at one time or another being seen by different clinicians and having to repeat tests or obtaining clinical notes and documentations to share with others that are following your care as well. So with that being said, what we're here to do is we're here to connect those gaps within a healthcare industry. So we're focusing on primary care physicians, hospitals, post-acutes, specialties, behavioral health, imaging, lab, pharmacy, public health, and payers, just to name a few. HIEs are patient-centered and will improve quality of care and patient outcomes. Next slide. So for example, Healthy Nevada here has 3.7 million unique patients at the current time. This list shows the breakdown of filling in the gaps with transitions within all care settings within the state of Nevada. This improves transitional care management, chronic care management, and Medicare reimbursement for both. Next slide. HIEs are being implemented throughout the US and can connect to any others by view of the patient-centered data home. Here at Healthy Nevada, this actually shows who we actually have connection with at this point in time, which is the state of Arizona, Utah, Nebraska, Idaho, Santa Cruz, and Colorado. By doing so, this improves the quality of care for the patient from all points of view. Next slide. So reasons to consider connecting to an HIE. Well, one, it provides a complete patient profile. You're able to see the patient's care from beginning to end from every care setting that that patient has gotten contact with. This gives a better picture to the physicians, therefore improves the quality of care that the physician is able to provide the patient. Secondly, it improves coordination of care to avoid redundancies in services and prevent medical errors. Like example, a medical error with a patient with hypertension, not knowing that a patient could be allergic to one particular medication. This would prevent those errors from occurring by utilizing an HIE. Third, it reduces the cost of duplicate testing, like repeated lab work. There are plenty of times I could speak for myself where I could see a primary and then see a specialist, and I'm constantly repeating the same lab work because the two don't connect and share their information with one another. And 4, it increases timely reporting and responsive support for quality of continuity care of a patient. And what I mean by that is, for example, if a patient ends up in the ER with high blood pressure and is a poor historian, that ER physician can actually utilize the HIE to actually find out that the medication the patient was taking had an allergic reaction. And they could stop from administering that same medication in ER, which would prevent a medication error. Something as simple as that for an ER physician shows so much value of the HIE in general. This actually improves the better quality that the patient is getting and a better outcome from that ER visit. Next slide. So the value of using a HIE for transition and care is actually quite simple. It improves quality of care, prevents medication errors, and decreases costs. Improving patient healthcare outcomes by streamlining care delivery across all settings. This includes emergency departments, hospitals, post-acutes, and specialties with primary care. As well as HIE is patient-centered. It's a system that helps support managing medical conditions more effectively, which improves care coordination activities needed to help manage chronic illnesses like hypertension and heart disease. So that's just a quick summary of how the HIE can be very valuable to any practice and for any clinician. And I am actually going to forward this back over to Lily.
Thank you so much, Brenda. That was really, really informative. Thank you for your time, and thank you for doing this for us. For those of you that have questions, go ahead and place it in chat, and we'll address them at the end of the webinar. But for now, we're going to take it over to Eric. Eric Maddox is from Reliance Healthcare, and he entered the health IT field by accident, having started his career in behavioral health, working with at-risk children in the foster care system with issues related to drug and alcohol abuse. Shortly after completing dual Bachelors of Science in Therapeutic Recreation and Management Information Systems, Eric found his way beyond clinical care and into operations to include information technology and financial management. Over the last 20 years, Eric has migrated out of the behavioral health and clinical care fields to focus exclusively on information technology. In 2010, Eric joined the efforts of the Regional Extension Center for Health Information Technology in Nevada to help lead efforts of EHR adoption and meaningful use achievement for eligible providers and hospitals in Nevada. Simultaneously, Eric was privileged to participate in the effort to establish a community-based HIE in Nevada to eventually be known as Healthy Nevada. In early 2014, Eric took over responsibility for the day-to-day efforts of Healthy Nevada, leading the statewide deployment of HIE throughout the state of Nevada. After spending most of his life in the desert Southwest, Eric took the opportunity to relocate from Southern Nevada to Southern Oregon at the beginning of 2017 to assume the role of the Executive Director of Reliance eHealth Collaborative. Eric, I hand it over to you.
Thanks, Lily. So I think this is going to work out very well to build off of Brenda's presentation. I'm going to try and go a little bit more into the weeds with respect to health information exchange content and services or functionality and how they might apply to cardiac management, to quality management within the community as a whole, but also into practices. So by way of background as a starting point, for those that might not be familiar, Reliance eHealth Collaborative is an HIE that provides health information exchange services throughout the Pacific Northwest to include parts of Northern California, the full state of Oregon and a growing portion of the state of Washington. Our participation base looks very similar to the slide that Brenda put up that had the circle with all the different settings on it. And so all the major health systems, commercial laboratories, and a whole range of ambulatory settings in the physical health, oral health, behavioral health space. We also have growing participation now among social service or social folks that are on the periphery of healthcare, but certainly doing things and performing activities for patients or clients in their case that impact and influence healthcare. As Reliance, and these are important as we get a little bit further into it, as Reliance, we deliver a number of different HIE-oriented services to our communities that we serve, including community health record functionality. I think Healthy Nevada refers to it as virtual health record functionality. We have closed loop e-referrals capabilities, direct secure messaging capabilities, event and clinical event alerts and notifications. And we do a great deal of quality reporting and population health data reporting for our communities. Most HIEs, not all of them, but most HIEs, and I know Healthy Nevada is like this as well. Reliance, along with a lot of HIEs, we are EHR or data system agnostic. And so if you have any experience in the health information exchange world, oftentimes you will start the process of connecting to an HIE for all the reasons that Brenda outlined. And sometimes you'll hear folks say, well, I have Epic, so I don't need a health information exchange, or I have Epic, so I can't connect to an HIE, or I have ECW, I have eClinicalWorks, I can't connect to an HIE, or eClinicalWorks won't allow me to connect to an HIE. All of that totally untrue. And so as HIEs, we tend to pride ourselves on being EHR agnostic. All of the use cases, all of the data that we work with, all of the organizations we work with, we tend to work with without respect to whether they're on Epic, NextGen, ECW, Cerner, go down the list of EHRs. Next slide, please. And so, again, I think Brenda touched on this. I've highlighted a little bit more. When we think about the HIE data set, the idea within Health Information Exchange most of the time is we want to connect up the data systems. We want to connect up the information systems that are out in the world to aggregate that data together in a patient-centered way, to make that content available through a variety of different mechanisms, to do all those things Brenda described, reduce the cost of care, reduce the frequency of duplicate testing, duplicate procedure, to improve quality, to use to transform the healthcare system, to help influence and inform the learning healthcare system that we're all hoping to get to at some point. And so within the Reliance environment, and again, many other HIEs, we take in a whole range of data set. In Oregon and Washington, that includes lab and pathology results, radiology reports, transcribed reports, cardiology studies, ADTs. You can go down the list. I don't have to read each and every bullet point for you. There are highlighted ones there. And so when we start talking about this, when we start talking about health information exchange within the context of quality management, and more specifically, when we start talking about health information exchange within the context of cardiac measures and influencing or tracking the cardiac measures within the quality reporting space. Each of the bolded ones or each of the darker blue elements, for Reliance at least, is where we are pulling data from. These are places that contain content that without these data elements, without this content in the HIE data set, would seriously and significantly impact our ability to facilitate transitions of care related to cardiac measures, to facilitate reporting on quality indicators or quality data for cardiac measures. And so we pull a wide range of data out of each and every one of these categories within the HIE and use those to go to the next slide, please, to help support the various cardiac measures that I think most of you, if you're in the clinical practice in some capacity, are paying attention to. Within the Reliance environment, within the Pacific Northwest, Reliance currently supports each and every one of these quality measures you see here. And I think from a Million Hearts program initiative, there's only one measure not included on here that an HIE cannot support. A robust health information exchange, pulling in data from a broad community like Reliance does and like Healthy Nevada does, has the ability ultimately to build reporting and support the quality measure reporting for each and every one of the measures you see here on the screen. And so next slide, please. And so when we talk about taking all that data in, that's great. We got lots of data coming in. Brenda talked about how much they have within Healthy Nevada, the number of unique patients that they're aggregating data on. We both point out here all the different data sets that HIEs come in. That's wonderful. You got all this great data. But it's increasingly becoming less and less about how much data you have and more about what it is that you're doing with the data. And so when it comes to using health information exchange data to influence each of those measures we saw on the previous slide, to improve quality of care, to reduce cost of care, et cetera. There are a number of things, particularly within the cardiac space, that we do here within Oregon and Washington, within our HIE environment, that go directly to those spaces. And so when I looked at the services at the beginning of the slide deck, one of the very first things that we deliver out into our community with respect to quality reporting, with respect to influencing quality of care, effectiveness of care, with all of that data coming in, looking at adverse drug reactions or adverse drug events. We have alerts and notifications that we push out to our provider network, to our systems that participate with us, that monitor the INR for patients on Coumadin, on any number of other anti-clotting medications. And so when we see a series of diagnosis or medication indicators and an INR result come across of less than 2, an alert is sent out the door. We also have the ability within our environment to look at patients that have heart failure diagnosis, evaluate their ECGs as they come through. And when they present with an ejection fraction of less than 40%, alerts go out the door. And so proactively, we're moving out into our community and into our participants to help use the data that's being provided into the HIE to influence immediately the quality of care and the cardiac health of those patients. More broadly, HIEs have the capacity to typically do quality measure monitoring and reporting. This, for us, looks like dashboarding at both the provider, location, and organization level for control around quality performance. And so all of those measures that you saw earlier on the prior slide have a dashboard associated with them for all of our participants that help us to benchmark and help the providers, the IPAs, the physician group, the CEOs, or the physicians themselves to monitor how they're doing with respect to these quality measures. And one of the key differences in using this sort of system or using an HIE for this purpose, as opposed to using the functionality provided within their EHR or within a secondary reporting system, is the health information exchange is aggregating data from all over the community. These may be data points, these may be data elements, which we refer to as supplemental data for the purposes of HEDIS and quality measure reporting. These may be data elements that are supplemental to what they've ordered themselves or what they've generated on their own within their EHR. And so the HIE has the ability to bring in blood pressure values, to bring in pulse values, to bring in blood work, to bring in lab reports, to bring in radiology reports, evaluate all of that, and deliver that to the physician or to the provider group for monitoring and measurement of quality reporting, without respect to whether that provider actually ordered the test that's in question, or whether the provider knew from the patient through an interaction with that patient that the result was a positive or the result was a negative. And then finally, in terms of managing transitions of care, as those alerts come through for them, as various indicators within those quality measures indicate that or specify that a patient needs to be transitioned out, or in some cases transitioned from a hospital into a provider group. HIEs utilize referral systems or direct secure messaging for referral management for that transition of care. That allows the practice typically to capture a TCM code for their Medicare patients, a transitions of care management code for their Medicare patients. And in the case of IHS or Indian Health Services groups, in many states, it also qualifies them for access to 100% FMAT reimbursement. And so financially, it has an impact by utilizing HIE services and functionality on the practice and on the operations. And I think, next slide, that's it.